a Doctor of Pharmacy degree, which he obtained from the Northeastern University of USA. He also has a diploma in the German language, so he is well versed in the German language, and I believe that if he takes the microphone, he will say good morning in the German language. This he obtained from the University of Düsseldorf, Germany, and he also has a BA in Economics and Geography, KNUST. Now, shall we all give him a big ow? Ladies and gentlemen, with a round of applause and a standing ovation, shall we please welcome the chairperson for this occasion, Dr. Sefa Bediakun. Now, you will continue to pray and enable him with a clap offering before he changes his mind. Sir, we want to take your response.
Guten Morgen. Guten Morgen. Ich freue mich, dass ich hier bin, and it is a great opportunity to be here. I thank you very much for also the opportunity to chair this function. In fact, malaria has been with us for a long time, and when our colonizers came, malaria saved us. Now, we are at a point that we say we want to eliminate malaria. My question to DG is that, are we safe to eliminate malaria? Because at one point, it saved us. Now we are trying to eliminate it from our communities. Maybe there is a different way. We have an immunity built against our next colonizers, so we don't need malaria this time. Anyway, the program is packed. Other countries have been able to eliminate malaria, and Ghana is also trying to follow the suit. We have our DG here. We have one of us here is welcome to this great program. And as the chairperson, I would like to say that yes, I accept the opportunity to chair this function, and I will call on the MC to continue the program. Dankeschön, and ich freue mich, that Sie sind here, and I pray that everybody have a great time. Thank you.
Thank you very much, Dr. S. Bediakun, the Council Chair of the Ghana Health Service, for that remarks and accepting to chair this program for us. So we are privileged to have dignitaries as well as corporate organization heads here in our midst, and our partners are also here. And I would like to take the opportunity to introduce them to us. And from the WHO, we have Dr. Kosia Kwachi, representing the officer in charge, Dr. Frank Luli. Dr. Kwachi, let's see you. Thank you so much. We have the Chief Imam, Alhaji Mohammed Tijani Swala, Municipal Chief Imam for Lungwa, Krowo. Thank you for coming, sir. From GHSCPSM, we have Mr. Innocent Ibebunam, the Country Director. Thank you, sir. Then from Amrin, we have Dr. Charity Binka, the Executive Director, also here with us. Then from Molinlo, we have Mrs. Nokodia, who is the Chair, National Malaria Advocacy Committee. Then we have our malaria champion, whom most of us know her, Ohinere Gifty Auntie. From PAF, we have Mrs. Elena C, also here with us. From USAID PMI, we have Mr. Siste Zigli Mugabe, Malaria Advisor. We also have Mr. Isaka Hanif, Business Manager, West Africa, ENVU. Mr. Seth Opuni National Rep of Envu, Ghana, also here with us. Mr. Vincent Owusu Anson, Pharmaceutical Society of Ghana, also here in our midst. Then from the Ghana Health Service, we have Mr. Raymond Goka, Deputy Head, NTP. We have Dr. Ebo Hammond, Director, Health Administration and Support Services, also here. We have Mrs. Mabel Asafo, Acting Director, Health Promotion Division, also here. We have Dr. Nanaya Opepra, Deputy Program Manager, NMEP. We have Dr. Franklin Esiedu Bekwen, who is the Director, Public Health Division of the Ghana Health Service. Abuaji, also here with us. We also have our keynote speaker, the Chief Director of the Ministry of Health, who is also representing the Honorable Minister, Dr. Alhaji Hafiz Adam, here with us. Thank you so much for coming. I'll call on my co-MC to also introduce the Krowo Assembly as well.
Now, in no particular order, we do this introduction. We acknowledge the presence of the Honorable Member of Parliament, Honorable Agnes Momo Late. You put this together for him, her, sorry. Engineer Emmanuel Odailaye is the parliamentary candidate for MPP Krowo constituency. And we acknowledge the presence of all assembly members here present in Krowo municipality. We acknowledge the presence of the Municipal Director of Education or his representative. Please give us a wave if you are around. Yeah, we acknowledge your presence. We are grateful you came. Please acknowledge the presence of the District Police Commander, very important, else we are not protected here. So do it together for him. We also acknowledge the presence of the Divisional Police Commander, the Kweshin Divisional Police Headquarters. We acknowledge the presence of the Board Chair, Nungwa Market Management. So the market as a management. Put your hands together for the representative. If the area head pastors of the Church of Pentecost is here, we acknowledge your presence here. And then we also acknowledge the presence of these specific organizations that were invited. The Endpoint Homeopathic Clinic, if the representative or members are here, please give us a wave. We will take note if you do not show up. And we also acknowledge the presence of the Spintex Medical Center, Nungwa. We acknowledge the presence of the Chairman, Ghana Road Transport Union, Nungwa branch. It is appropriate at this point to acknowledge the presence of the Municipal Director of Ghana Health Service, Lejokuku Municipality, and also the Krowo Municipality. The Medical Superintendent of Lekma Hospital, Dr. Jima Asante. The Chairman of the Nungwa Landing Beach Committee, Nungwa. Ifan Victory Clinic Hospital, Spintex Community Hospital, Inkum Hospital, Zimmerman Presby Health Center, Dampong Medical Center, Ni Afote Botre II New Life Orphanage Nungwa, the head pastor Maranatha Power Missions, Reverend Afote, and then the Market Queen Nungwa Market. And as and when we are finished with more credentials, we will acknowledge your presence. At this point, we want to take a welcome address from the representative of Nana Addo Dankwa Akufo-Addo, President of the land, The person who stand gap for him, invite to the podium the municipal chief executive of Krowa Municipality, Honorable Joshua Nimbote. Understand, malaria is giving a hell of a trouble because we want to eliminate it. So at this point, they are in a locked up meeting trying to get the key to eliminate malaria completely. Put your hands together for him. At this point, we will settle down with some cultural interlude, which will be provided by the Akuma drama troupe. Akuma, are you ready? Let's go.
you very much. Thank you very much. Thank you very much. Thank you. Thank you very much, Ekuma. Let's put our hands together once again for them, for that wonderful performance. So I'll acknowledge some other groups that are here in our midst. We have Madam Agatha Saki, who is from the National Association of Beauticians and Hairdressers. Thank you for coming. Then we have reps from the West African Center for Cell Biology of Infectious Pathogens, WACBIP, also here. Thank you for coming. Then we have reps from the Federation of People Living with Disabilities, also here in our midst. Thank you, they're over there. We also have Traditional Caterers Association. Traditional Caterers Association, thank you. Ghana National Tailors and Dressmakers Association are also here with us. They are not left out. The fisher folks are also here. Let's appreciate them. They give us fish. Thank you for coming. We have the clergy from the municipality also here. If you're a pastor or reverend, please, let's see you. Thank you for coming. Then CHMC, Community Health Management Committee members. They are also here in our midst. Let's see if you are here. Thank you so much for coming in your numbers. Then from the Ghana Health Service again, we have Dr. Ismaila Hamza, the Deputy Director, Human Resource, also here. Thank you. We have Mr. Ekuma Isaac, a Deputy Director in charge of administration at the Public Health Division. I want to know the link between your name and the cultural troupe. Thank you so much. So we'll move on with the rest of the agenda, and I'll call on the partner, WHO, Mrs. Akosua Kwachi, to give us a short address. Please help me welcome her with a round of applause.
Mr. Chair, the Honorable Regional Minister, the Municipal Chief Executive, the Chief Director, Ministry of Health, representing the Honorable Minister for Health, the Director General Ghana Health Service, Ohene Yeri Giftianti, National Malaria Champion, Parliamentary Caucus on Malaria, Development Partners, Directors of Health, Education, and other government sectors, private sector and NGOs, Head Pastor Church of Pentecost, Teshinungwa, and all clergy members present, Nimen, Amen, all protocol duly observed. Good morning. I deliver this statement on behalf of Dr. Frank Lule, the officer in charge for WHO, who unfortunately could not join us today. And I read, WHO is pleased to be part of the 2024 World Malaria Day commemoration under the theme, Health Equity, the cornerstone for achieving malaria elimination in Ghana. The focus this year is on advancing equity, gender equality, and human rights in malaria prevention, treatment, and care. Equity in access to quality health services is a guiding principle of the global strategy for malaria, particularly for the disadvantaged populations, as well as prioritizing the needs of the most vulnerable. With 249 million new malaria cases and 608,000 malaria deaths reported in 2022, malaria remains a significant global health challenge, particularly in the African region. Unfortunately, progress in reducing malaria has stalled globally in recent years. Not only does malaria directly endanger health and cost lives, but it also perpetuates a vicious cycle of inequality. The most vulnerable populations needing much attention include pregnant women, infants, children under 5 years of age, refugees, migrants, and internally displaced people, to mention a few. Hence, addressing gender, equity, and human rights issues in malaria is very important. In Ghana, the expansion of malaria vaccines through the National Child Immunization Programs and the seasonal malaria chemoprevention are key strategies to increase access to malaria preventive interventions for vulnerable children in remote communities. Similarly, the equity-oriented universal health coverage package, such as the National Health Insurance Scheme, established in Ghana, of which malaria treatment and prevention is integral, ensures financial protection for the vulnerable. Mr. Chair, ladies and gentlemen, ministers of health from African countries with the highest burden of malaria, including Ghana, committed to accelerating action to end malaria deaths in Yaoundé in March 2024. They pledged to sustainably and equitably address the threat of malaria in their respective countries and regions, which unfortunately accounts for 95% of malaria deaths globally. The ministers further pledged to increase health sector investment to bolster infrastructure, personnel, and program implementation, to enhance multi-sectorial collaboration, and to build partnerships for funding, research, and innovation. The importance of investment in malaria control and elimination cannot be overemphasized. Since the year 2000, the world has mobilized more than 50 billion to support malaria control and elimination efforts. As a result, 2.1 billion malaria cases and 11.7 malaria deaths have been averted within the period 2000 to 2022. This investment reduced malaria mortality rates by half, from 29 deaths per 100,000 population at risk in 2000 to 14.3% per 100,000 in 2022, despite the COVID-19 pandemic. Mr. Chair, I must say Ghana is vigorously pursuing this approach with the establishment of the Parliamentary Caucus on Malaria to drive elimination of malaria, which will only be feasible with the highest political will and investment, ensuring universal and equitable access and with all stakeholders and communities involved. Increased malaria funding is needed in order to save lives and further expand access to malaria prevention, diagnosis, and treatment services in the country. WHO and partners are therefore calling for high-level commitment to malaria elimination through investment in the fight against the disease to ensure a malaria-free Ghana. Mr. Chair, I must commend our funding partners who have invested massively in the fight against malaria over the years, which also has positively impacted on the gains in the fight against the disease. These forms of support have been in the form of human capacity development, technical assistance, provision of infrastructure, and logistics. Distinguished ladies and gentlemen, as I conclude, I call upon all stakeholders to focus on targeting available resources at places where the burden of malaria is highest and targeted at the vulnerable persons and groups in an equitable manner to achieve malaria elimination. I end here by affirming WHO's continued commitment to the National Elimination Agenda for a malaria-free Ghana. Thank you very much for your attention.
Thank you very much. Put your hands together for the madam. So a patient walked into the consulting room confidently and spoke directly to his medical officer, seated in his consulting room chair, that, "Doctor, I have direct malaria." At this point, the doctor was confused because throughout medical school, he was never exposed to anything called direct malaria. He consulted Google, and in this day, he would have consulted some artificial intelligence mediums to find if he can get something. He gathered nothing. And so, in all humility, he politely asked the patient back, that why do you think you have direct malaria, and what is it? He said, I have direct malaria because yesterday night when we were taking food, one mosquito just entered my mouth and I swallowed it. And that is direct malaria. Ladies and gentlemen, we just received a message from WHO representative, and we are about to receive one from the USAID rep. And please help me welcome Sister Zigiru Mugabe. Now, if I murder your name, you will forgive me. I try the name again, Sister Zigiru Mugabe. You can do the alignment of your name when you come. And I'm happy to announce unto you that is the malaria advisor. I respectfully ask that if we eliminate malaria, what will you be advising on?
Seek treatment. Ministry of Health Director General, Ghana Health Service Director General, ladies and gentlemen, all protocols observed, it is a pleasure to join you to commemorate the World Malaria Day. The United States is Ghana's largest bilateral development partner. In 2023, the United States Agency for International Development, USAID, invested over $90 million in the health sector for maternal, newborn, child health, global health, and malaria. 28 million of that funding was targeted at malaria. USAID implements U.S. presidential initiatives and priority programs, including the President's Malaria Initiative, PMI. We work with the national malaria programs across the world to reduce malaria deaths and illness. And since its launch in 2005 by the US President George W. Bush, PMI has invested over $9 billion globally toward eradicating malaria. In Ghana, PMI was launched in December 2006 and has invested over $460 million to tackle malaria over the past 18 years. This investment has focused on procurement and distribution of mosquito nets, malaria rapid diagnostic test, preventive malaria treatments for pregnant women and children under 5, known as seasonal malaria chemoprevention, indoor residual spraying in the highest burden prone areas, and strengthening the capacity of service providers as well as the capacity of the health system to deliver quality services. Through this support and partnership with the government and people of Ghana, we have achieved impressive results. The prevalence of malaria in children under 5 years of age has dropped significantly from 27% in 2014 to just 9% in 2022. Also, the percentage of pregnant women who take the 3 recommended doses of preventive malaria treatment has risen from 28% in 2008 to 60% in 2022. These improvements are the result of the strong collaboration among Ghana's National Malaria Program, PMI, the Global Fund, to which the United States is the single largest donor, and other partners. We also acknowledge and appreciate the crucial role that healthcare workers play toward preventing and treating malaria cases. Despite these improvements, there are still some challenges we must tackle, including stockouts of essential health commodities. To maintain Ghana's success in combating malaria, it is important to ensure constant availability and accessibility of life-saving malaria commodities. Malaria is a challenging public health problem, but our efforts can also be hampered by logistical and bureaucratic challenges. For close to a year, essential medical supplies, including malaria treatment and rapid diagnostic tests, insecticide-treated nets, among others, have been held at the Tema port, pending customs and other clearances. This is the type of delay that sets our efforts back and ultimately could cost lives. We need our government of Ghana partners to help remove this type of delays permanently for the benefit of the Ghanaian people. When we work together, we can make sure these critical supplies move quickly from port to patients. We appreciate Ghana's leadership and vision on fighting malaria. Just 3 months ago, we were gathered for the launch of the Ghana's National Malaria Elimination Strategic Plan. A malaria-free world means a healthier and safer future for us and our children. The United States government is committed to working with Ghana to make this a reality. Thank you very much for your attention, and I wish you all the very best as we continue to join hands to combat malaria.
No, it's okay to continue to clap for him until he takes a seat. And at this point, he obviously declined to answer my question. And it's not every question that should be answered anyway. And so put your hands together for him for avoiding my question. Because obviously there will be a follow-up. And he doesn't want to drift into controversial realms. So put your hands together for him one more time. Language is something, but you see, first impressions of what you are called are very important. I'm sure malaria, the organism called malaria, will not be happy today because of what it is called. The literal meaning of malaria comes from an Italian language. Mal means bad, and aria means air, so bad air. So at the beginning, where they do not have capacity to determine that malaria was actually caused by a parasite called Plasmodium species. There are several of them, Malaria, Viva, and then the worst culprit in Ghana here is Falciparum. They thought that the malaria disease was caused by bad air. Fast forward, it is not bad air, but it is caused by a parasite. And so watch what you are called today. You will struggle to change that mark on you. And so if we are evolving to become called a doomsday country, we should not be happy about it, because it will be a tag on us in future. There is a place in Teshin, which I always use as an example. They call the place Sea Lady. It used to be a chop bar. Sea Lady Chop Bar. Years on, when I'm sure when the children got involved with Christ, they realized that, hey, now man, water chop bar the other. They have struggled to change the name to God is King. But you see, the generation that lives still refer to the place as chop bar. Ladies and gentlemen, it is the same thing with the Ghanaian currency. A lot of people cannot relate with 100 Ghana. They still call it 1 million. Why? How can you all of a sudden eliminate all of us from becoming millionaires and we are cedinians? No, we want to still remain as millionaires. And if you are wondering why I'm saying this, I'm telling you all this so that you will know that I have taken a standpoint in this matter. Ladies and gentlemen, I am honored to introduce to you the National Malaria Champion. Please, with a round of applause, welcome Ohineyeri Gifty Auntie to say some few words. And I must confess that today is the first time that I'm privileged to see Ohineyeri physically. And I think that the TV screen owes her an apology because she is much beautiful.
New started pet in Liakemino Ofiona. Thank you very much. And well, before you ask the question, when we succeed in eliminating malaria from Ghana, I'll be championing the cost of not allowing it to come back. So I have answered you. Mr. Chair, Paramount Chief of Nungwa Traditional Area, Overlord of Dangme State, the Chief Director, Ministry of Health, the Director General, Ghana Health Service, the Director of Public Health, Ghana Health Service, directors, heads of health institutions, departments and agencies, distinguished partners, the area head, Church of Pentecost, Teshinungwa, invited guests, fellow Ghanaian stakeholders, and champions of health, including my own colleagues in the media. I was giving a speech, but they know me. Can I find out the number of people here who've ever had malaria? Koye bianyona malaria dan hanima na onine. Everybody, isn't it? Everybody. This is not just about you knowing somebody. Let me stand on that to make this clarion call. Choboi! 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 We are no more going it lovey-dovey. We are determined to eliminate malaria from Ghana, and it can be done. Other people have done it. And so can we. Ghana, first south of the Sahara to gain independence. First to do this, gateway to West Africa. What can't we do? So first of all, I need you to believe that we can do it. Do you believe that? Do you believe we can eliminate malaria from Ghana? Do you believe it? Oh, I can't hear you. Do you believe it? Okay. Now let me go on. Today, on World Malaria Day, we stand united against a preventable disease that has plagued our communities for far too long. Malaria steals lives, burdens families, and hinders our nation's progress. However, I stand here before you today as the National Malaria Elimination Champion, not with despair, but with hope. Because remember, we can do it. Envision a Ghana liberated from the shackles of malaria. Picture children excelling in schools. Now I need to see you smile. Your children doing well because they go to school every day. They've not been plagued with malaria and so feeling sick and can't go to school. Parents working without a shadow of fear and community blossoming without a constant threat of illness. This is the future we want to forge together. The benefits of malaria-free Ghana are vast. Stronger families, a healthier workforce, and a thriving economy awaits us. But this fight cannot be won alone. We need everyone on board. Say after me. Me too, a day inside. Me too, a day inside. I have a role to play. I am responsible to achieve this. It is possible. Okay, now let me go to the communities. I want to plead with all of us to use mosquito nets. Don't use it for styles. My sisters, my mothers, o fine waka cafe waterless styles ona taleje eni kefi net ho me net o fine je no akefio. Seek prompt and appropriate diagnosis and treatment when you feel sick. Not every fever is malaria. Jake call him popo alo o sweaty alo o down febo no ko be malaria wo ya shop ko no ya he medicine or chofa o fine. You need to get tested and be sure that it is malaria before you start treatment. And you must champion our right for prevention measures in our communities to reduce mosquito breeding places. Assembly members, are there assembly members here? Unit committee members. Kenya fading crowd, well, Kenya be. Take personal and collective proactive actions towards ridding your home. This is your personal responsibility. Workplace and community of stagnant collections of water that can breed mosquitoes and spread malaria. You do not need to wait on government or town council or any other person before you take steps for your personal and collective health. Now to stakeholders. Let's join hands in implementing the National Malaria Elimination Strategic Plan, which we launched a few months ago. Investment in research development and access to life-saving tools will go a long way towards achieving the malaria elimination goals. Remember, it is possible. We can do it, and there's no political twist to this one. By joining hands, we can create a future where malaria is a thing of the past. Let us demand more resources, implement effective strategies, and empower each other. Together, we can build a malaria-free Ghana for everyone. Chobwe! 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 It is possible. So let us work towards eliminating malaria from Ghana as soon as possible. Thank you and God bless you.
And as a unionist, when I hear Choboy, then something else comes to mind. Boy! So this is how we do it in the union way. Ladies and gentlemen, put your hands together for the National Malaria Champion, Oyineyere Gifty Auntie. She has said a lot that indeed we all need to get involved. I've noticed that it looks like the program is getting too much Queenie. The Queen's language is taking over. And that reminds me of some small school in some Accra village where they decided that they will not speak any other language apart from English on the school compound. And so this young boy was coming to school and he noticed that the teacher's bicycle that he actually rode to school was in the scorching sun. Now, how to report to the teacher to take the bicycle from there to somewhere cold was a problem. But he mustered courage and went to the teacher. He said, "Please, teacher, your bicycle, it is in the good afternoon." And if communication is about people understanding you, the teacher also communicated in similar fashion so that the boy will get the message. He said, "No problem. Please go and pick the bicycle from the good afternoon into the good evening." Ladies and gentlemen, if you are going to me, you want bluffo sanechon. And if you are my way gafio, couldn't you make game, you washing. A jacket gamma shipon, gamma noni, boname, I may heleno again. You try the wine, honey. If you make a caution, no, ya call, dear Tomoni, Sankofa dear, Yanchi. All of a sudden, some phrases in English have become a bit skeptical. You are not sure whether you are political or not. But it is a fact that it is possible is an English phrase. Whoever have capitalized on it to send a message across, I do not care. But I'm saying that eliminating malaria is possible. Ladies and gentlemen, there is a landlord in this Nungwa vicinity. And he is the MCE for the Krowa municipality. Ladies and gentlemen, with a much better round of applause, please help me welcome Honorable Joshua Ni Bote, the MCE for Krowa, to deliver the welcome address.
If I say Nungwa Krowo, it means we are fearless. Let me apologize for drawing the program backwards. I apologize on behalf of the Nungwa Traditional Council. Krowo has been in the news for very good reasons for the past 1 month, but it has come to pass. It is not for any reason that you chose Krowo to celebrate this year's National Malaria Day. I, as MC, I always lead in cleaning our gutters. And last year, out of the 261 MMDAs, I was second in cleanliness. Adenta was first. I had 100%. Adenta had 100%. But because of the K and the A, they gave it to Adenta because of the alphabet A. So you are home. choosing Kruwo to celebrate and commemorate this day. New chairman, who was with me, we're launching our Kpilijo Festival today. That's why I've apologized on his behalf. He will be here with us. He is representing the Nungwa Manche, Honorable Nilaya Futiagbo. I also greet the Wulomo, the Chief Director, Ministry of Health. I salute the Director General, Ghana Health Service, the Program Manager, National Malaria Elimination Program, the Area Head, Church of Pentecost, Teshinungwa, invited guests, ladies and gentlemen. I greet you all. I'm profoundly honored to extend a warm welcome to all who are gathered here in the Kruwo municipality to commemorate World Malaria Day 2024. It is an important day on the global health calendar, and we feel very privileged to be selected out of the 261 districts for this year's celebration. It means Kruwo is still working to the glory of God. The World Malaria Day, which falls today, 25th of April 2024, is celebrated every year to increase the awareness of malaria in the global community while highlighting the efforts that are being made with the long-term goal, as well as celebrating the milestones achieved so far on this ongoing journey to make the world a malaria-free world. Malaria is an age-old disease with a wide range of symptoms, starting from absence to a very mild to severe symptoms and even death. My grandmother used to tell me, if you have a broom worth 5 cedis to clean your gutter in front of you, and you don't do that, you have the flies there, they come on your food, they bring you malaria. You get to the hospital, you have to see a doctor, and you have to pay for consultation. You see the doctor, and you get a prescription. If you are not lucky, you are put on diet. And that is where the trouble starts. You don't have money. You are told to take in snail, crabs, dry fish, and the rest. The broom which you didn't buy for 5 cedis to clean your frontage, it's gradually sending you to your grave. That is where we are. You travel out, and they never talk about malaria. The drains are made for water to flow, but we are comfortable dumping refuse into the drains, and the mosquitoes come hard at us, and this is where it is taking us. The Ghana Health Service, Ministry of Health, they do the education day in, day out. The assemblies, we take our horns on our cards, we educate people to be sensitive and friendly to the environment. And this is where we are as a country. We don't keep our surroundings clean, and the malaria, the mosquitoes get to us, and we are sent into the early graves. And an old lady in the house becomes a witch for our irresponsibility. This is where we are as a country. It is for me and you to build a country. Leadership, yes, but I don't think you can get mosquitoes in the big men's houses. They are free, their houses are sprayed every time, and here we are. Malaria is an old disease. The world has made many strides in the prevention and treatment of malaria. However, it is now aiming to eliminate the disease and this will require countries, communities, and individuals to put in extra efforts, commitment needed to achieve this goal. The theme for this year's celebration is health equity, the cornerstone for achieving malaria elimination in Ghana. Very recently, Mr. Chairman, the Korowa Municipal Assembly stakeholders, together with the Korowa Municipal Health Directorate, had a town hall meeting with all stakeholders and committee members where we identify ways to achieve key strategic objectives required to achieve the national goal of eliminating malaria in Ghana. The participants in the meeting looked at key priority issues to be addressed, resources and the support needed, key activities to be taken, and persons responsible for the activities, timelines, as well as indications of change required to measure the progress made towards achieving the strategic objectives. Mr. Chairman, at the end of this meeting, I was pleased to inform you and all who were gathered there that we had drawn a 5-year action plan which we are committed to following towards the elimination of malaria in the Korowa municipality. We will ensure that our committee members will have adequate knowledge about malaria and the right attitude, practice, and requisite skills for malaria elimination by 2028. We are all well aware of the critical role human behavior plays in malaria prevention, especially in the areas of environmental health and sanitation. Therefore, we will use social and behavioral change strategies at all levels within our community, including schools, religious gatherings, and social gatherings to promote malaria prevention. We will also encourage our community members to use malaria prevention methods such as sleeping in insecticide-treated mosquito nets to prevent malaria in our cherished pregnant women. Mr. Chairman, the Municipal Assembly and together with the Health Directorate will ensure that our health facilities, communities, over-the-counter medicine sellers, and other health outlets test all suspected malaria cases and treat only confirmed cases. It's important. We get to the drugs seller's shop and I have malaria, there's no prescription, and over the counter, we get drugs. There's no prescription. Highly dangerous for us. Finally, Mr. Chairman, I wish to commend the good work the National Malaria Elimination Program and the Ghana Health Service, the Ministry of Health, and the Korowa Municipal Health Directorate is playing together with stakeholders in preventing malaria in the Korowa municipality. My wish that at the end of this event, we will leave here with useful information and network to help us develop our homegrown strategies in our various communities to aid the national efforts in eliminating malaria. I promise you that in the coming months and years, we in the Korowa municipality will work together with stakeholders to keep malaria high on the municipality's agenda through our sustained commitments, continual investment, and innovative strategies, helping the nation achieve malaria elimination by 2028. Malaria elimination in Ghana is achievable, and it is possible. Our part, in our own small way, will help achieve this goal. Thank you all for coming, and I wish you a successful program. May God bless Nwakruwo and make our homeland Ghana great and strong. Thank you.
Thank you very much, Honorable Joshua Nibote, for that welcome address. At this point, I am comfortable because we've all been properly welcomed now. We we want to continue the program so that we do not take it too much from the good afternoon into the good evening. Mene one year malaria sunny. Ejaga malaria e watri. E wa share koni jeni wo ba control e don to mo tutu e ni wo fi o. Shi agbeni won jele ye je nkura ni wo ya jowo. Ni wo bi ni baba catch malaria tapuamele no ni ji. Ejaga e ba ton history no kwemono shi je no koni ya no. Don at this point I want to acknowledge the presence of various municipalities that are represented here in terms of the health directorates. Please acknowledge the presence of Lejokuku municipality, the representative. If you are here, just give us a wave. Lejokuku. Wonderful. We acknowledge your presence. Please acknowledge the presence of Ablekumanov. Ablekumanov. Well, they didn't catch my eye. Ablekuma West. Wow, beautiful. North, we acknowledge. West, we acknowledge you. Ganoff. Ganoff. Well, thank you very much for coming. And then Ayawaso Central. Put your hands together for them. At this point, we will take update from the malaria, on the malaria situation in Ghana. Where are we now? Certainly, I can say that we are not where we want to be, but I believe that we have made strides as a people. That is worth celebrating. To present the updates on the malaria situation in Ghana, please help me welcome the programs manager, Dr. Kozia Mom. It is as if you are not sure that we can eliminate malaria. Your clap offering was too feeble. Do it better for the programs manager.
Thank you. I'm sure you are very confused. I don't look like Dr. Mao. I'm the Deputy Program Manager, Dr. Nanaya Opipra. Dr. Chair, all protocols observed. As we wait for the presentation to show up, I believe that it is obvious that we are all sure about this elimination agenda. And I like the energy. I don't know whether at a point we should be saying praise the Lord or we should be saying choboi, because I see a mixture of it. Good afternoon. Good afternoon. So I'm grateful for the opportunity to give the update on malaria situation in Ghana. I'm going to start with introduction, and then I'll briefly talk about the strategic plan we had prior to the elimination strategy, and then we discuss some few progress we have made, look at the challenges and the recommendations we have to address those challenges. And before I conclude, I'll touch on some key issues in the current elimination plan. Together with our stakeholders as a service, we are committed to delivering a malaria-free Ghana. We believe that this is possible, and if you are able to do this, it is going to contribute to a socio-economic development of this country, and it is something that we all have to work on. The strategic plan we had before the current plan was looking at reducing case incident by 50% by 2025, reducing malaria-related mortalities by 90%, also by 2025, and also achieving at least 6 districts having achieved pre-elimination, all by 2025. And this is what we have been doing over the years prior to 2024. But we've been trying to put together a number of interventions, preventive interventions, which includes environmental management, killing the baby mosquito, that's the larvicidin. We've been doing this across the country. We have also been spraying the interior rooms of the places where people sleep in some areas of the country, which is called the indoor residual spraying. Also, we have been distributing nets, and we have encouraged everybody to sleep under the net. Aside these vector control interventions, we have also had malaria vaccination in some districts across the country, which is very key for the elimination agenda. There are also chemopreventive interventions we have given out. We give out medicines to pregnant women when they are 16 weeks of their gestation. We do that monthly until they deliver. We also give medicines to children under 5. You know, children under 5 are very vulnerable. In the northern part of the country where malaria is seasonal, we give them anti-malaria at the beginning of the rainy season. We do it monthly until the rain stops around November. And this is to prevent them having malaria in the severe form of the disease. And so we do a lot of these interventions all to ensure that we achieve the goals we have set for ourselves. Now, in the event that anybody has signs and symptoms of malaria, we advocate strongly that you get tested. And when it is confirmed, you get treated. This is not like the direct malaria the MC was talking about. So we ensure that everybody is tested, and if it's positive, you treat. There are a number of other cross-cutting interventions we also have as a service. Now, for all these interventions we have done over the years, we have seen some progress. In the next few slides, I'll be presenting the progress we have seen. You realize that with respect to mortalities, we have seen mortalities reduced from 333 in 2019 to 146 in 2023. And that is good. I think it is good for us to clap for ourselves. We have all helped to contribute to the reduction of the mortalities we have seen over the years. Unfortunately, we have seen a slight increase in our admissions. And if it is important to note that if you factor in the population, it is more or less like it has stagnated. It is still important that we look at the issues leading to the admissions and classifying admissions due to malaria very well, and then putting in the strategies to address them. If you look at testing over the years has increased. We have seen increase from around 34% in 2019 to around 98% in 2023. And as the testing is increasing, we are seeing more cases. The good thing is that even though our institutional cases are increasing, over the years, survey data has shown that parasite prevalence in our communities has consistently decreased. We have seen a decrease from around 28% in 2011 to 8.6% in 2022. And Greater Accra happens to have the lowest malaria prevalence, whilst Oti region happens to have the highest malaria parasite prevalence of 15%. And so we really need to work more ensuring that this reflects in the institutional cases, mainly ensuring that we are doing a lot of the data cleaning. We are also ensuring that cases are tested and treated, and exactly those confirmed cases are reported. With respect to coverages across the country, all the registered children for seasonal malaria chemo prevention, almost all of them were dosed. In 2023, we dosed almost 100% of the children, which means that we're able to really protect the children as we have planned. If you look at IPTP, that's the medicine we give to pregnant women, you realize that there was a slight dip for all the levels of IPTP. And this was because during the course of the year, we had some few stockouts of SP, and that contributed to that dip. But I'm sure that now that that is resolved, going forward, we will see our pregnant women having the SP and getting protected. And of course, the unborn child will also be protected. If you look at distribution of nets, it has been increasing. It means that we are giving a net to our pregnant women, we are giving a net to caregivers who bring their children for Mrs. 2 injection, and that has seen an increase. But an interesting discussion about net distribution is that even though we are distributing the net, the survey data is showing that net use is going down. And therefore, it is important that we have a discussion around net use, how to develop effective social behavioral change communication strategies to improve that, and also think about other alternatives for areas where net use is very, very low. And this is not just with the general population, but I realize that even under 5s, net use is also reducing, as well as pregnant women. So it's something that we all have to work on. So in summary, all we are saying is that we have seen a reduction in our mortality, a 56% reduction in our mortality, which means that in 2019, 1 person was dying of malaria every year. But in 2023, 1 person is dying every other day. We are also seeing 50% reduction in under 5 malaria case fatality, even though we are also seeing some increase in malaria admissions. Testing is increasing. We are hoping to achieve 100% testing across the country. The good news also is that we have seen parasite prevalence reduce over the years. And I would like to discuss some few challenges which I believe stakeholders will have to know, and then we'll all find solutions to it. The first thing is the net use. A lot of people have the nets, but they are not using the net. We need to advocate for the net use and also look out for other alternatives for malaria control or vector control in our various communities. The other key thing is for us to ensure that the data available for us is optimal. Because for us to tell that we have reached elimination, we need quality data. And so we will continue to advocate that verification and validation of data is done at all levels. Also, our health workers should ensure that test, treat, and track is optimal. We are still not seeing the 100% we want to see. We have to push for this to happen. It is still a challenge. And one last challenge we want to discuss. If you have realized over the years, we have had just about 50% of the resources we need to implement all the interventions. What it means is that even if we have been able to achieve this with just 50% of the resources, you can imagine what we could have achieved if we had all the resources needed. And so we really need to come together, the private sector, all partners, let's come together, let's invest and ensure that we eliminate malaria together. So it's a challenge that we have to look at and get it sorted out. Before I conclude, I just want to share some few slides on the elimination agenda. Together with stakeholders, we have stratified the country into 4. Some areas in Ghana have very low transmission. Some areas have low transmissions, other has moderate and high. And depending on where you fall, the number of interventions we have designed for you. If you are able to do this, we are sure that elimination can be done. In the next 5 years, we are looking at least eliminating malaria in 21 districts in Greater Accra, of which Krowo is part of.
Shall we please be on our feet as we welcome the original chairman for this occasion, Honorable Nilai Afuti Agbo. Put your hands together for him as he comes. Remarks. The true son of the soil, sir, we welcome you. Ni no be watu amugoni eto najian ni ehawo opening remarks e no ba oba fe clado no bo watu ekrede ko ni ohawo closing remarks. At this point we will thank Dr. Sefabedi Akun for holding the fort and standing in the stead of Ni for us. Thank you very much, sir, for holding the fort. Ni, you take over from this place, but I crave your indulgence that the program will continue while you ponder over some few things to tell us. Thank you.
Thank you. So, Nietzsche, we're just giving updates on the malaria situation in Ghana, and we have seen progress. We are hoping to do more. we now have an elimination agenda, and the elimination agenda is a sub-national approach. We are hoping that by 2028, at least 21 districts in Greater Accra would have eliminated malaria. We learn lessons and then we scale it up to the other districts across the country. We are also hoping that in the next 5 years, we'll reduce malaria-related mortality by 90% and malaria case incident by 50%. For us to achieve this, all the districts will continue to do the other interventions. But in addition to these interventions, there are some new interventions I quickly want to touch on. Malaria vaccination will have to be expanded. We are hoping to have more resources to expand that. Also, we are introducing a new intervention called the post-discharge malaria chemo prevention. We know that children are very vulnerable. When they have malaria or any other disease and they have anemia and they are admitted, whilst they are being discharged, we are going to give them anti-malaria to cover them for about 3 months. This is because whilst they have anemia, if they have malaria in addition to it, it is going to lead to possible mortality, and we don't want to allow that. And that is why we are introducing this new intervention across the country. Also, in the moderate to high areas, we are going to expand the SMC to include the older children. Currently, we are doing it for children under 5. Indoor residual spraying, if we get more resources, we also want to expand it. A new intervention we will be adding to the agenda is what we call the intermittent preventive treatment among school children. Children within the ages of 5 to 15 years will be given anti-malaria per term to help protect them so that they can focus and learn and become very bright children for our country. In areas of very low transmission, a new intervention will be introducing also in Krowo as what we call the mass drug administration. We'll be giving ourselves anti-malaria, and that is going to clear the parasite in us so that even if a mosquito bites you, there wouldn't be a parasite for the mosquito to pick and transmit. If we are able to do all these interventions, we are sure that elimination of malaria in Ghana will be possible. But as we have always said, this cannot be done only by the service. All the stakeholders will have to come on board. Political leaders, chiefs, religious leaders, ministries, agencies, community members, the media, private sector, we all have to come on board to ensure that this is done. And I'm very sure that in our generation, we will one day look at ourselves and indeed clap for ourselves that we have eliminated malaria. God bless us all.
Let's do it better for him until he gets to his seat. That was the Deputy Program Manager for the National Malaria Elimination Program, giving us an update on the malaria situation in the country. On this note, I'll call on the Director General of the Ghana Health Service, Dr. Patrick Kumar Abuaji, to give us an address. Please, let's welcome him with a round of applause. Let's keep clapping until he reaches here.
Thank you very much, and good afternoon. I think it's a good afternoon. This is a beginning, so we'll not end up in the evening. Thank you. And thank you, Nana Pepra, for the presentation. But I'm sure to some people you have delivered a scientific paper. You need to tell them about the case fatality rate, but mortality is death, and all those seasonal, we need to try and explain to them because we are speaking to the general public. Chairman of the Ghana Health Service Council, and just the outgoing chair of this event, Dr. Sifa Bediakon, our Chief Director of the Ministry of Health, who is also working in supporting the Minister Designate, Honorable Bernardo Okoboy, our members of Parliament and the Parliamentary Caucus on Malaria, Municipal Chief Executive of Krowo, and all the assemblymen here, our divisional and regional directors of health services, our development partners, USAID, WHO, UNICEF, and all those who are here, Municipal Director of Health Services and Medical Superintendent Lekma, our malaria champions, Nanaire Giftianti, Mrs. Charity Binka, Mrs. Dokodua, and all the others who have been championing malaria elimination and control over the years. Our traditional and religious leaders, distinguished invited guests, the media, ladies and gentlemen, all other protocols observed. I am indeed pleased to join you to commemorate the World Malaria Day 2024 under the global theme of accelerating the fight against malaria for a more equitable world. Nietzsche, the theme was chosen in recognition of how malaria continues to directly endanger health, cost lives, and perpetuate a vicious cycle of inequity, especially among the vulnerable populations such as pregnant women, infants, children under 5 years of age, refugees, migrants, internally displaced people, and indigenous people. It also calls on countries to strengthen their malaria responses by increasing investment in research and development of new tools that benefit all people at risk of the disease, especially the poorest and the marginalized. Even though malaria may have chased out some people, if we don't take it, it can also chase us out of our own community. So it is important that we eliminate malaria. Nietzsche, although the situation in Ghana is not entirely different from the global picture, we had to adopt a theme that suits the peculiar situation we find ourselves now. In this regard, the theme for the Ghana for this year's commemoration is Health Equity, the cornerstone of malaria elimination in Ghana. This local theme reflects the core of the recently launched National Malaria Elimination Strategy, which aligns with the statement that malaria impacts vulnerable populations such as pregnant women, children under 5, and people living in rural and remote parts of this country. And I'm sure when you saw the charts, you see that in the more underdeveloped parts of the country, malaria prevalence seems to be, parasite prevalence seems to be high. Nietzsche, distinguished ladies and gentlemen, as a country, we are on the path of eliminating malaria, and as such, we have put in place strategies as outlined in the National Malaria Elimination Strategy 2024 to 2028 document to achieve this objective. As part of the strategy, Ghana is targeting the first 21 districts for elimination using multiple interventions. Coincidentally, all these districts are in the Greater Accra region, of which Nietzsche, I'm happy to inform you today that your district, Krowo, is part. Out of curiosity, one would ask why all the elimination districts are in Accra. But let me hasten to add that the targeting is not based on a simple reason. We have attained this enviable feat so far as a country through the hard work of these districts. The 21 districts have been selected due to their low malaria burden levels, less than 1% parasite prevalence, that's the amount of parasite in the system, and less than 50 per thousand population malaria incident, which means that for every 1,000 people in these districts, only 50 have malaria, which is quite low. And I think we must really give a hand to these districts. It's not a small feat. It's about environmental sanitation. It's about the way we treat our environment. It's about the way we manage ourselves. These are all, and abide by some of the interventions that we do. Ladies and gentlemen, special appreciation goes to all the stakeholders who have contributed to this success. The elimination fight has just started, and we cannot let our guards down. We need to maintain the momentum to actualize this elimination. Chair, distinguished ladies and gentlemen, as part of the strategies and interventions that are being adopted in this elimination phase, we are expanding the existing interventions to include mass drug administration, that is, we'll treat people irrespective of their status. Post-discharge malaria chemoprophylaxis, that is, even when you have been discharged, we'll put you on some preventive medication. Intermittent treatment of malaria in school children, and scaling up malaria vaccination as recommended by the World Health Organization. As Nana Pipra said, we have started several districts already, and this year we're going to add 43 more districts to increase the number further. Distinguished ladies and gentlemen, the one question that begs to be answered, however, is whether we can really eliminate malaria from this country. To all intent and purpose, the answer is yes. We can and we will. We can eliminate malaria if we all participate as stakeholders, ensuring that we do not leave anyone behind. We have, over the past years, reached across divides as stakeholders and worked to considerably improve the malaria testing rate from 38% in 2012 to 98.2% in 2023. What it means is that for everybody we treat, 98% of them are tested to be sure that you have malaria before we treat you. We have reduced malaria prevalence from 27% in 2011 to 8.6% in 2022 as a country, not in the 21 districts. Significantly reduced deaths due to malaria from 2,799 in, that is the number of cases that have been dying in 2012 to 146 in the year 2023. And I think that is an important achievement. We must all give ourselves a hand. These sustained gains in illness and deaths assures us about the effectiveness of our interventions and amplify our hope of elimination with improved and sustained efforts. We cannot let our guard down. We need to do more and continue to work on. Globally, 43 countries have eliminated malaria so far, with Cape Verde being the most recent and the third African country after Mauritius and Algeria to be certified by the World Health Organization as malaria-free. This announcement surely reignites the hope that malaria elimination in Africa and by extension possible in Ghana. And I must add that the very time we were eliminating, we announced our effort to eliminate malaria. Cape Verde, who had just eliminated malaria, just beat us in football. So we thought that maybe it can even improve our football skills after we eliminate malaria. So let's add that to some of the benefits. As a service, we recognize the need to resolve issues such as fragmented service delivery, ineffective referral systems, and lack of support and interaction within the primary healthcare settings to facilitate the elimination of our agenda. So our quest for resolution has culminated in the network of practice model, where we try to network as many facilities and share resources. The network of practice is a framework to strengthen primary healthcare, focusing on equity. As a special purpose vehicle for attaining universal health coverage, the networks of practice will help to improve the organization, quality, utilization, and equity of primary healthcare services and make the same available to everyone in need. With this approach, people suffering from malaria will receive quality care close to where they live or work through the model health centers. Chair, other distinguished guests here, in bringing my message to a conclusion, I would like to reiterate that when it comes to malaria elimination, the buck does not stop with us only in the health sector. It is a multi-pronged approach involving all stakeholders within the district. And I am happy today that we have the municipal chief executive here, religious groups here, traditional rulers here, women's groups, and other civil societies here to commemorate with us and pledge their commitment to efforts geared towards the malaria elimination. This is our expectation from all stakeholders. We want communities to own the elimination, put it on their agenda, and strive for their communities to be free from malaria once and for all. Ladies and gentlemen, as a service, we shall collaborate with all stakeholders on this journey and achieve this shared vision. On these notes, I want to thank all our partners who have supported us through this journey. For the existence of time, I cannot mention all of them, but I see most of them here. We need to win this together. Therefore, I urge you and continue to push for further support to make the shared dream a reality. Malaria elimination in Ghana is possible. And as a service, with your total support and commitment and working with us, we will progressively get there. Thank you all, and God bless you, and God bless the country, Ghana.
Let's continue to clap for him. Thank you very much. That was the address by the Director General of the Ghana Health Service, Dr. Patrick Kumar Aboagye. Thank you, sir, for the address. We have some organizations who are represented here, and I would like to acknowledge them. We have PAMCA, Ghana chapter, if you are here. PAMCA, are you here? Thank you so much for coming. Then Innovative Vector Control Consortium is also here. Thank you for coming. Shalina is also here. Sumitomo Chemical is also here. Thank you for coming. Please, let's clap for them. Pharmaceutical Society of Ghana, they have already been introduced. Mitsui Chemicals and Crop Life Solutions, they are also here with us. Madam Marjorie Kwanzaa from Fidelity Bank, thank you for coming. Mr. Baba Sadiq, Esquire, also Deputy Director, Claims, National Health Insurance Authority, is here with us. Thank you for coming, sir. We have Mr. Sylvester Sebaya, Chief of Party, PMI Rich Malaria Project, also here with us. Madam Jemima, Municipal Coordinating Director, she's also here with us. Thank you for coming, madam. We have the Clean Town Health Center staff, and they are in charge also here. Thank you for coming in their numbers. So on this note, I'll call on the Ablade Drama Club from the Nungwa Secondary School to give us a skit. Please, let's welcome them with a round of applause.
Even if it's not coming, it's coming.
Hey, my sister, nowadays, the way they are not buying things from us, it's not good, though.
Oh, my sister, yesterday I sent my tilapia home.
Hey. Good morning. How are you doing? Thank God. Fresh pepper, fresh pepper. Atadi 5 cedi.
Tilapia 70 cedi, 60 cedi. Tilapia
Atadi fresh.
My sisters, I said I heard you say something. Me myself nowadays, the way the malaria case is skyrocketing these days, it's not good at all. People are dying. May our Lord help us all.
And what has God got to do with malaria? Hey, my sister, gone are the days we used to organize communal labor to clean our market squares, gutters, and weed our surroundings. But nowadays, what do we see? Fresh pepper, atadi fresh.
Tilapia 50
Yeah.
cedis, 70 cedis, tilapia 50 cedis. Oh.
Good morning. How much the tilapia? Or get me 200 Ghana cedis. Yeah. I hope they are fresh. New one. From Akosomo. Right.
Can you imagine? Fresh pepper.
Tomatoes, 2 cedis.
Fresh pepper.
Fresh tomatoes.
Atadi fresh.
2 cedis.
5 cedis.
Fresh tomatoes.
Fresh pepper.
Fresh tomatoes.
Fresh pepper.
Malaria is killing us.
It's killing us. Good morning. Please, you to buy for me.
My tomatoes.
Okay.
Fresh one.
Fresh pepper.
How much is it?
Fresh pepper.
Or get me 10 Ghana cedis.
Fresh pepper, 5 cedis. Fresh pepper, atadi fresh.
Fresh tomatoes. Let me hold it for you.
Atadi fresh. Fresh pepper,
I'm
pepper.
2 cedis.
5 cedis. Fresh pepper.
When I was coming, it's like I heard you talking about malaria.
Yes, so the malaria is killing us.
Wow. And who caused it? You as a market woman selling, look at your environment. The issue of malaria, the fight is togetherness. It's about attitudinal change. We can't go to the church and be fasting and be praying for malaria to leave this country. No, it's impossible. We have to check our surroundings. Gone were the days we organize communal labor on Saturdays to desert our choke gutters and weed around our surroundings. These days we are doing opposites. We dump the refuse into the gutters and we expect government to clean them. Is that right? You go to hospital when you are pregnant, they give you the net, treated mosquito net. Sleep inside. You will use to cover your abuboya, the one you call tricycle. Can you imagine? Others are using to fence their garden when it's meant for human being. Where are we heading towards? The most annoying parts. Some are using for fishing. How much is fishing net? That you rather use treated mosquito net for fishing. If we'll be able to desert our choke gutters, weed our surroundings, when our women are pregnant, we will encourage them to attend antenatal checkups. And then postnatal, I think Ghana will be free from malaria. I will have a time to talk with you next time. I'm a medical doctor.
Thank you, Doc. Thank you. 2 cedi ammo. They don't buy nowadays. They are using all the money to buy medicines to cure malaria. Let me go and sell my tomatoes.
I should pass the other side.
Take one of the chairs. Take one of the chairs.
What were your man say?
Hey, Nakai.
One class test.
Hey.
Man, no back school, na maba.
Bole, mami subai.
Ene ko mami na de gba mo na eh.
Mi mama neji.
Bona sani ma ashianya why mami.
Oh yo. Careful.
Hey, Auntie please, good afternoon, good evening, good night. Auntie please, classes.
Hurry up. Have I not warned you about this boy? Ma, you did.
Mama, please.
If you talk again and I land you slap, how many times do you want me to talk to you about this boy?
Ma, he's just my friend.
He's just your friend. You want him to impregnate before you know he's not just a friend. Eh? You want him to impregnate before you know he's not just a friend. Babie. Let me know Teshi. Oshamwe Osami. This are no 4 year Oshiote school. This are no over 4 year Oko way here, and never call Nibia no Shamwe. Join no funny beer, I don't even Mama Bombo. And you laugh, you think I'm down with you. When I get back. Oh, for override poor, bear motion. Oh, yeah, for here, or Keke and Flicky can hear say.
Please, classes.
Yeah, Flicky can hear say, can honor, can you can noble classes. Tomorrow in the morning, you will see me in front of your door. Coming to what that useless mother.
Hey, my mother is not useless.
Shut up! The next time I see you close my daughter, I'll castrate you. And where is that naughty girl too? She'll come and meet me more. I see.
Adole. Man was dumb.
See this man I married you.
Adole.
Why are you shouting my name?
Did I shout your name?
Don't you know you're shouting?
I'm sorry.
You're always disgracing me.
Adole, I'm back for round 2, please.
Round what?
Round 2.
You are dreaming.
I'm dreaming. Adole, you know, Adole, you have refused to feed me downstairs. Upstairs too, you will not feed me, Adole.
When you were going, did you leave any money?
Did I leave any money?
You use your money on alcohol. That is what you do.
Look at you. You are smelling alcohol. Go back. Go back.
See you.
Go back and spell. Nonsense. Where is my tray?
You're asking me.
Tell her to prepare me spaghetti.
There's no food in this house. Go back to the spot and go and eat there. Nonsense.
Look at this one. I was hearing your voice in my office. I came home and you are telling, okay. Look, let me warn you. The next time you leave the window open for mosquitoes to bite my baby, Adole, I swear, you change my name to, do I have a name? I don't even know my name.
Ma.
Oh, this girl will not let me rest in this house.
Ma, please come and help me. The water is heavy.
Didn't I tell you to fetch the amount you can carry?
Please.
Stop disturbing me. I don't like that. And I've told you, stop covering this water. I don't like lifting when I'm about fetching water. I've warned you.
Mom, I always tell you that the teachers in my school always teaches me to cover the water in my house because it can breed mosquitoes.
Eh?
Yes, ma.
I never thought of it too.
Today you know.
Anyways, I don't care. Hurry up and go and fill up this thing before I lose my temper. Bone. What program over? It's not time for the students. Give me away. She'll be sick.
The two clothes is two.
Give me. A chair. Now a chair. Where is this girl? See, she has started her laziness again. Kwe, they should not say I know your school. What is it?
I'm not feeling well.
You're not what?
I'm not feeling well.
Since when?
Since yesterday.
And you didn't tell me. Let me see. Open your eyes. Hey! Naturally, you won't kill me. You won't disgrace me in this town. IT has done it for you. He has impregnated you.
No, I'm not pregnant.
Then what is wrong with you?
I think I have malaria.
You have what?
Malaria.
Is it malaria or malaria?
Ma, please, malaria.
If I open my eye, you're already leading me to your school. Oh, yeah?
Ma,
hurry up before I hit you. I don't want to hit you and die. Hurry up.
I have malaria.
Hurry up. The mic, auntie. Yes, that's correct. It's very correct. Good boy. Who again? Okay, yeah, you. Fever, yes. Fever. So,
Sure, hey.
get fever. Who again? Yeah, you. Yeah, nausea is
Knock, knock.
correct.
Good morning, my children. How are you?
Yeah, fine.
Good.
Oh, good morning.
Morning.
Salole, what brings you to our class this morning?
Mommy teacher. Iba shamo, here do wadenche. One of your students is practicing reproduction with my daughter.
Oh.
He has impregnated my daughter.
Aye.
Yes. I'm in set of Aite.
Oh, sorry. It's not true.
What is not true? If I land you slap, you will say the truth. Please.
Madam Maduli. Oh, fine. Not true.
Inye ma not true.
Not true. Oh, let me know feel. Can not true.
Oh, fine. Iba be a habu. Come here, headmaster office.
Inga babaya. But you know, babaya le neke. No bat shut me. What?
Madam teacher.
Oh.
Shepono can be sure in Bali.
Follow me. I will take you. I'll take you to heaven. Let's go. Knock, knock.
Yeah, come in.
We are in.
Papa headmaster. Lebine iba le brofo sane kengono. Ka kemi akashin kam inye ma calm me down akankeke. Imba bi akenbatashi inye do wa denchi. Excuse me. It doesn't concern me. I came here for my business. No penny imba femo. Okay, fine. Say what you want to say. One of your students has impregnated my daughter. No one imba bi ene.
My dear, have you tested whether it's malaria or you are pregnant?
She is pregnant. I know she is pregnant.
Calm down. Now, before any judgment, let us first test her to see whether she's pregnant or she has malaria or both. So, I'm not paying for anything. I'm not paying for anything. All I can do is that I can direct you. My assistants here will take you to the nearest clinic at the back of the school. So, if you can please take care. Thank you very much.
So, I think we should go to the nearest clinic.
Yeah. Don't worry. I, as the assemblyman of Krowa, will pay everything.
Thank you, Richmond.
You're not paying for
anything. Stingy man, is your money?
Don't worry. Please. Let's go.
I said, me, I'm going back to my children. The students are making noise. They did me.
Yes.
Where?
Please, this way.
Because of our young lady over here. To check if she has malaria or she's pregnant. Because her uneducated mother over here is claiming that she is sick or she's pregnant or whatever.
Pregnant.
But please, we want to check if she is pregnant or having malaria or both.
Really?
Yes.
Pregnant?
Yes.
Ache, sit down. Okay. So, Ache, what is wrong with you?
Doctor, please, I think I have malaria.
What symptoms are you having? I feel very cold nowadays. Is that all? And I don't feel like eating too. Oh, okay. So. Okay, so Madam Adole, per the test I conducted, I have realized that Ache is not pregnant, but rather she has malaria.
Thank God.
Are you sure it's malaria? Because she's showing symptoms of pregnancy.
Yes, please, Madam Adole.
If that's the case, then I also want to test. Because it's free, right?
Are you sure?
Yeah, I'm sure. Please.
Ache, come this side.
Okay, so since we have noticed that she don't have, she's not pregnant, but she has malaria, so I think we should go now. Oh, thank you very much for the test.
Okay, you
Bye.
can take your leave.
So we are taking our leave.
Please go.
Okay, so Madam Adole, how old is your pregnancy?
5 months.
So what symptoms have you been experiencing, Madam Adole?
Auntie Ness, I get tired very easily. I feel feverish too. I also don't feel like eating, yes.
And have you started antenatal clinic?
It's not really necessary.
She don't have the money. Oh. Okay, so do you sleep under treated mosquito nets?
I don't even have.
Why? Okay, so I have one here for you. This is what we call a treated mosquito net.
Is this not pillow?
No, please, Madam Adole. It is a treated mosquito net. And you have to make sure you sleep under this in order not to get malaria. So Ache will teach you how it will be fixed. Okay?
I won't.
Ache, please, you have to calm down.
My husband will teach me. Don't mind this girl.
Okay, if you say so.
We'll be
Okay,
taking our
so
leave.
Madam Adole, I'll prescribe some medicines for you. Okay?
Please. Something is wrong with my baby.
What is the matter?
It's not my son.
Shut up and let me talk. Shut up. Antinez, please, my baby.
I think I need to call the doctor. Please calm
When
down.
nothing happens to my son, of course.
Shut up and let me talk. Shut up. Antinez, I came back from the washroom and then I found him so hot.
You went to the spot, not the washroom. You drunkard.
Look, don't get me angry. Don't.
Yeah, hello, nurse. Is there any problem? Yeah, I'm around. I went for a meeting, I'm around.
My son. Doctor, my son.
Madam Nurse, what's the problem at hand?
It seems there's something wrong with the daughter.
Wow. So sorry.
Doctor, please hurry up.
We are so sorry.
You are sorry for what?
The child was brought already dead.
Hey!
Doctor, don't tell me what I'm telling you, doctor.
You should rather tell us what you have done to your child.
I left the boy. Hey,
We don't fight here, please. We don't fight here. Come around and tell us what you did to your child.
I left the boy.
Did you take him to any hospital or clinic?
No, it was this morning I noticed the boy was having temperature. So I prepared herbal medicine and then...
Herbal what?
Herbal medicine myself.
You mean concoction by yourself?
I was thinking
Mr. Man, calm down. This is not the time to raise temper. It has already happened. We have. Calm down, gentlemen. The harm has already been caused, but there's a way out. There is a district in Ghana called the Krowo district. And according to the Ghana Health Service, they are among the 21 districts with low malaria cases. And the question is, how did they get there? How did they get there? They put measures in place, and they are still putting more measures. And according to the service within the area, they are projecting that by 2028, there will be no issue of malaria in Krowo district. How are they going to achieve that? They have interventions. One, they are going to supply more treated mosquito nets, not meant for gardening, not meant for abuboya, not meant for fishing, but for we as citizens to sleep under it. Number two, they are going to team up with Zoom Foundation to make sure all stagnant waters within the communities are sprayed at least every month. They are also going to make sure women who are pregnant will not stay home for self-medication. They are going to give them anti-treatments and postnatal treatments. So men, whenever your wives are pregnant, don't keep them in the house. It doesn't cost much. It's better to save life than to destroy life. Brethren, we as individuals, we also have a role to play. We need to wake up and stop the habit of throwing rubbish into gutters and drains, and rather join hands together and desert our choke gutter at least once in a month. It has been done before and can be done now. Finally, children of school-going age, class 2 to class 6, they are receiving the treated mosquito nets, class 2 and class 6. Because when you are pregnant and they give it to you, it takes 3 years. So by the time the 3 years will elapse, your child in class 2 is also coming to adapt more. And then to cap it all, there is going to be administration of anti-malaria vaccines for school children, the entire community members, so that the issue of malaria will be brought to minimum or zero by the year 2028. And I, as a medical doctor, I believe with PDA, where the P means practicable, very, very practicable. The D means doable, we can do it. And the A is achievable. If we can all come together, Krowo in the next 4 years will be free from malaria pandemic. Therefore, with one accord, we say, let us put our hands together and fight against malaria in Krowo district and Ghana as a whole. Thank you.
Oh, put your hands together for Ablade Abi. And so that was actually a performance from the Nungwa SHS. And I am a proud old student of Nungwa Secondary School. And I dare say that this was the beginning. Today, if you see me comfortable behind the microphone, it started like this. And so put your hands together for the young ones. I think the ground is set for us to receive the keynote address and to give the keynote address. But before then, let me acknowledge the presence of some few invited guests in our midst. We want to thank Dampong Medical Hospital for their support. And also acknowledge the presence of Reverend Dr. Benjamin Kwame Danso, who is the chairman of the NDC Krowo constituency and is standing in for the Member of Parliament. Put your hands together for him. You can give us a wave if you're around. Yeah, so like I indicated, the ground is set for us to receive the keynote address. And to do the keynote address, please welcome the Chief Director of Ministry of Health, Alhaji Hafiz Adam. Club offering is something you do not buy. And so do it better for the Chief Director.
Good afternoon to all. Nietzsche, I bring you greetings from your son, Honorable Bernard Oko Boy, on whose authority that I'm here. He has asked me to represent him, and he has also asked me to extend his sincere greetings to you. The Director General of the Ghana Health Service, your boss, Bernard Okoboy, has asked me to congratulate you for the effort that you have put in making this day a reality. Chairman of the Board of Ghana Health Service, representatives of the World Health Organization, the Presidential Malaria Initiative, distinguished invited guests, ladies and gentlemen, I cannot proceed without recognizing the presence in our midst of the malaria champion, Ohiniri. Do you know that she's the first lady of the Little Republic? So I tell you today. Nietzsche, on this World Malaria Day, I stand before you with pride in our collective achievement, as has been espoused today, as far as elimination of malaria is concerned in Ghana. We all know why we are here. We gather here today to commemorate the global fight against this devastating disease and celebrate Ghana's significant strides in malaria control. This year's theme, as we are told, is health equity, cornerstone for malaria elimination in Ghana. Resonates well, deeply with our country. Chairman, as we celebrate our progress in malaria control, we want to acknowledge the vital role the health equity in achieving our ultimate goal. And our ultimate goal is elimination. And we have received assurance from the champion. We have received assurance from the general. The Director General of the Ghana Health Service, who are often called the general in the civilian barracks. So if you have a general leading the charge, there is no way you will lose the battle. So I am also convinced that we shall eliminate malaria in this country. It is possible in the health sense. I'm not referring to the possibility in the political sense. Our nation has been engaged in relentless battles against malaria over the years. Today, as we sit here, we take a moment to commend the tireless efforts of the Ghana Health Service, our distinguished partners, dedicated healthcare workers, our researchers, and all our stakeholders and communities who have been at the forefront of this fight. Your dedication and your commitment has led to a significant decline in malaria cases and deaths, and we value your integral role in this fight. Mr. Chairman, however, we recognize that the journey to elimination is not complete. We are not yet there because we have not yet achieved excellence. We have not reached the 100% mark. With this understanding and a shared vision of a malaria-free Ghana, the Ghana Health Service, in collaboration with our esteemed partners, has boldly decided to embark on the ambitious path towards malaria elimination. Since our last World Malaria Day gathering, our dear country, Ghana, has made significant progress. We have unveiled the National Malaria Elimination Strategy Plan, which spans from 2024 to 2028, a comprehensive roadmap that not only paves the way towards a malaria-free future Ghana, but also signifies our unwavering commitment to this noble cause. This plan is a statement to our steadfast commitment, strongly emphasize reaching the most vulnerable, thereby ensuring health equity is at the heart of our efforts. Ladies and gentlemen, we are deeply grateful for the unwavering support to our global partners, the Global Fund, the U.S. Presidential Malaria Initiative, the World Health Organization, Gavi, and many others. Their contribution, both in terms of funding and technical expertise, have propelled us to where we are today. We want to salute you for all that. Mr. Chairman, we have a road path to eliminate key priorities, a road path that will lead us to the elimination of malaria. Nana Chair, distinguished ladies and gentlemen, today we celebrate progress and a shared vision. We envision a Ghana free from the burden of malaria, where every citizen, regardless of location or socio-economic background, has equitable access to effective malaria prevention, diagnosis, and treatment. Ladies and gentlemen, permit me to highlight some of the key priorities. The first, but not I'm going to read it not in a particular order, strengthening surveillance, which requires early detection and promotes treatment, are very, very crucial in our fight against the elimination of malaria. We as a government will endeavor to invest in robust surveillance systems to identify malaria hotspots in Ghana and target our interventions accordingly. We will also scale up vector control. We know that the fight against mosquitoes, carriers of malaria parasites, remains paramount. We will prioritize the distribution of insecticides, treated bird nets, work with key sectors and agencies to intensify environmental management interventions, and explore innovative vector control methods. Promoting community engagement. Our communities, today, it has been revealed that Krowo district has taken the lead. They have provided leadership among the rank and file of all the districts in the assembly. And we need to commend them for that. So we admit that communities are the backbone of our malaria control efforts. We shall therefore empower them by promoting awareness, encouraging behavior change, and fostering ownership of malaria prevention strategies. Chair, last but not the least, we shall invest in research, which we think is very, very critical to developing a new diagnostic drugs and vaccines. And this will ensure we stay ahead of the evolving parasites and mosquito resistance. Chairman, let me conclude by calling the nation to action. In achieving this, all in line with our objectives and goals, requires a very strong collaborative effort. As we commemorate this day, I would like us to reconsider our roles with a renewed mindset and reaffirm our commitment to this new era of malaria elimination. We call for country ownership at all levels, at governmental level, public-private community, the private sector, the businesses, corporate agencies, as well as our cherished health workers. Let us all embrace this national goal and take personal responsibility to ensure we achieve Ghana's malaria elimination goals and objectives. We all know funding is crucial at this critical time to ensure the elimination strategy is fully funded to achieve our goals. Malaria elimination is an investment in our future. Therefore, I call on all stakeholders to support mobilizing domestic and international funding that is needed to augment what is available in order to sustain our efforts. Chairman, the comprehensive national malaria elimination strategy plan outlines the roadmap to achieve our goal. We must work together to ensure its implementation at all levels. Our ministry is very much committed to provide effective and efficient leadership, provide strategic direction, facilitate collaboration among our stakeholders, support in mobilizing resources, and ensuring the efficient and effective utilization of the resources that we so mobilize. We shall also advocate for increased domestic and international funding as far as this project is concerned. We will also actively engage other ministries and agencies, recognizing that a holistic approach is very, very essential for the elimination of malaria in our country. Together, we can create a Ghana free from malaria through collective action and unwavering commitment. We have done it before during the COVID. At the heat of the COVID, we realized even the Ghana Army was taking cover. It was our gallant health workers who rose to the occasion and fought the COVID-19. I want to thank you so much for the bravery that you exhibited. We want to see a future Ghana where our children can sleep soundly with both eyes closed, where our families can thrive and succeed without thinking of malaria and its negative effects. And we want to see our nation, Ghana, reaches its fullest potential. We want to see a future-free Ghana from malaria. On behalf of my honorable minister designates, I want to express my sincere gratitude to all of you for coming to grace this very, very significant and important function. I wish you God's blessings. Thank you very much.
Do it better for the Chief Director. Chief Director, thank you very much, and our regards to the Honorable Minister Designate. We wish him well. At this point, we are almost done, and so if you are almost exhausted, please bear with us. Within the next few minutes, we are out of here. It's about time to take the closing remarks from the chairperson, but it's obvious that I have to introduce him properly because we did not have the opportunity to introduce him at the beginning of the program because somebody stood in for him. Our chairman for this occasion is a true son of the soil. Put your hands together for him. Honorable Joseph Ni Lai Afutiagbo is a Ghanaian politician. He hails from Katamanso, Nungwa, in the Greater Accra region of Ghana, and was at one point the Greater Accra Regional Minister of Ghana. Why won't you put your hands together for him? These are no mean achievements, please. He attended the Ghana Institute of Journalism, where he obtained his diploma degree in public relations, marketing, and advertising. Honorable Afote Agbo is a man who has served his people and country very well. And if it is an inscription, very well would have been boldened. He was the member of parliament representing the Katamanso constituency in the 4th, 5th, 6th, and 7th parliament of the 4th Republic. A round of applause for him. Now, it is important to place on record that he never lost an election. He voluntarily retired not to go to parliament in the year 2020. Now, prior to this, he served as the vice chairman as well as the chairman of the Katamanso constituency. While in parliament, he served on the Environment, Science and Technology Committee, Youth Committee, Sports and Culture Committees. He also served on the Privileges Committees, Lands and Forestry, as well as the Gender Committee. He served as a Minister of State at the Office of the President in 2010. He also served as the Regional Minister of Greater Accra Region between 2012. He was then reassigned to serve as the Regional Minister of Volta Region in 2013. He again served as the Minister of Greater Accra Region from 2014 to 2016. He is the Regent of Katamanso. He is also a member of the Nungwa Traditional Council, where he serves as the Chairman of the Ethics Committee of the Nungwa Traditional Council. Ladies and gentlemen, please help me welcome to deliver the closing remarks, Honorable Afote Agbo, who is a proud Presbyterian and also happily married to a woman. Oh, I think that you will enable him with that clap offering as he comes. And of all the profile that I read, the interesting part that to me is that he is happily married to a woman.
Thank you very much, Mr. MC. The Chief Director of the Ministry of Health, the Director General of the Ghana Health Service, health directors of our districts, municipalities, and all stakeholders within the ministry or within the health sector. The chairman of the NDC Kruwa, who doubles as the rep of the MP for Kruwa, Agnes Namumulate, IMC for Kruwa, all protocol duly observed. First and foremost, I would like to apologize for coming late. It is not because I don't have any regards for you as people. I'm somebody who is very obedient, someone who respects everybody, no matter what your age. Because as a human being, you need people to respect you and work for you. Whether they are below you or they are above your status. Though I came late, but I have picked up some intelligence from the comments from our leaders within the health sector. And that gives me some kind of encouragement and motivation that we shall finally get to our destination. When you talk about malaria, in fact, we had a meeting, and in the middle of the meeting, your invitation was brought on board to be discussed by the paramount chief, the King, Professor Odafio Wolenchi. And for the fact that this program is about malaria, I offered myself to represent the paramount chief in this program. Because my younger brother, who was at the age of 1, and I was 4 years at the time, died out of malaria sickness. And if that guy had lived, some of the challenges that I've gone through, I believe strongly that it wouldn't have happened. So when I hear the name of malaria, I have been a victim myself, not once, not twice. I've experienced it several times, and I know how painful it is. And if you're not lucky, your life would even be taken away from you. So I would like to thank the organizers, those who sat and even decided that we should have a program like this, so that some awareness of those health service directors who are to go into their various districts to go and then create awareness. Because without awareness or without educating our men and women on the ground, people wouldn't even know that it is the filth that we have in our gutters that creates or that gives us malaria out of mosquito bites. So we should never, I can see from the efforts that you have all put into organizing this program, the youth, the men and the women on my left, I can see there are young men and women coming up within the health sector who will be ready to take over from those of us who are fading out in the future. And I can see the zeal and enthusiasm that our leaders use in telling us as to what we should do and what not to do. And what even breaks the camel's back is when I heard from the chief director that all your tools and things that you need on the fields to do your work will be provided. That one even made me so happy. And I can assure you that knowing my brother Okoboy, who is a brother and a friend, because I was with him in Parliament for 4 good years, and I saw him when he was so active in the area of health, and I was yearning and always crying that this young man should one day be made a minister of health, and it has happened. I have the encouragement that you will be given whatever tool that you need in making sure that our people within every corner of this country get whatever they need in solving the health problems that they have in connection with malaria. My brothers and sisters, malaria kills more than any other disease. And it kills very fast. And if we sit aloof and we don't do anything about it, then we'll end up having issues at hand. And I don't think that's the way for us to reduce our population. So let us all, wherever we find ourselves, be very vigilant, very active to provide whatever service that we have to provide to our people so that we shall make a mark when we are not even there. Wherever we find ourselves, our names will be mentioned for years and years to come. And whatever respect that will be given would be extended to our children and even our grandchildren. At this juncture, I would like to encourage the Chief Director and the Director of Health Service to be strong enough, because I have been a minister before. And mostly we rely and depend on our directors and chief directors because they are the professionals in the areas where we are assigned to take up our responsibilities. It is not because we are on top, and it is not because one is so abreast with whatever he is asked to serve. If not that, a medical doctor wouldn't have been assigned to take up the Ministry of Defense. So, Chief Director, Director of Health Service, General Director, I will encourage you to be strong enough, wherever you find yourself today, now that you are in charge, make a mark so that one day, your names would be mentioned. I thank you very much for your encouragement, for inviting us to come and give also our minds to the people, and to also motivate and encourage you in a way. And I want to also assure you that as leaders of our various communities, it is not only giving injections to people that eradicates malaria. Coming together and energizing our people to come together to clean our gutters and clean our environment would also solve our malaria problems. We will assure you of contributing our quota to the fullest. At this juncture, I would like to thank you so much for the effort and what you are doing for Mother Ghana. Thank you very much.
Let's continue to clap for him until he takes his seat. Thank you very much, Honorable Ni Laye Afute Agbo, representing the Kro Traditional Lungwa Traditional Council as a chairperson for this occasion. Thank you for that. So I call on the Municipal Director of Health Service for Krowo, Dr. Sally Day, to give us the vote of thanks. Please help me welcome her.
Thank you very much. Ni Chairman, kindly permit me to stand on the existing protocol to deliver the vote of thanks. First of all, I wish to thank God Almighty for bringing us all to this lovely venue safely, making it possible for us to gather here for a very worthy cause. Our thanks also go to Ni Chairman Ni Laye Afute Agbo, the regent of Katamanso and a member of the Nungwa traditional area, for gracing this occasion beautifully with his presence and steering the program to a successful end. A big thank you also goes to our Chief Municipal Executive, or Municipal Chief Executive, of Krowo, Honorable Joshua Bote, for hosting us in this municipality. We wish to also thank the rep of the Member of Parliament for gracing this occasion. We also thank the Assembly members who have worked with us to bring this program to a successful end. We would like to thank the Chief Director, Ministry of Health, the Director General, Ghana Health Service, the Director Public Health, Ghana Health Service, the Chairman of the Ghana Health Service Council, the rep of WHO, USAID, PMI, the Program Manager, National Malaria Elimination Program, for organizing this special event. A big thank you also goes to our agencies and partners at all the various levels for supporting this year's celebration. We are very grateful. A special thanks also goes to the area head, Church of Pentecost, Teshinungwa, for making their auditorium available for this year's celebration. We thank our invited guests, representatives of organized groups, representatives of private and child facilities, as well as our public facilities, our pharmacies, and over-the-counter medicine sellers, among others, for honoring our invitation to this special event. We would like to thank our distinguished ladies and gentlemen who took time off their schedules and come from far and near to join us celebrate this all-important day. Finally, Mr. Chairman, I wish to say a very big thank you to the hard-working staff of the Crowell Municipal Assembly in general, and the entire staff of the Crowell Health Directorate, the Lekma Polyclinic, Cleantown Health Center, our various CHIP zones, our CHC members, and our community health volunteers in particular, for working tirelessly to ensure that this event is organized successfully. We thank you so much. Aiko Wandanyeshi, and God bless you.
Yeradon, if you get Majale Mifio, Konishida, Eye Emu, Yagami. Ni, over the walk on Nuni, walk by Shete, Jenny Petrum, Kwa Yesu, Shimoe, National Malaria Elimination Program. Okay, Yeradon. Ani Esheni, Oboa de Noche, Kim Professor Undiakashi, Noni Efie, 1 year so. Mukweke nye ba ihani mukupu ebate na jang. Iwo iradon. Wanchone kekba nonu wakeda bubu ulomo shiche. The overlord of the Gandangbe. Okay, leun iradon. One member of parliament, Neji Honorable Agnes Momo, Monibata Mihale, Okelefe, Yowa Ajonye, Engineer Emmanuel Udai Lai, Neji parliamentary candidate, Kehan MPP Crow Municipal, Leon Wake, Oyura Don, Assemblymen, Assembly Women Feniba, Yeradon Akanyeba Kwa, he say. Agbene Mofemo, ni Oyanoko Femo, she Nutumoni ne or Otuobe, no Batami, no one Nutumoni ne for Wake Oyura Don. Director General. Onuga, she waka oyiradon onu, yowa ajobo. Ni odomomi amanchei, ni bediakun, oba chakebo, ofele nana bediakun, oba fele ni bediakun, bo radon ake odomomi ha wachama. Nungwa secondary school bi, nye radon, nye shemoni nye keba, wakase ni bi sang yemin. Agbenenwe Inko MC. Inko MC is the PRO of the Ghana Health Service. Nana Ando, right? Yeah, Ando. Jacob Ando. Oradon, Owa, ni Nitumoni ne Fifan. Agbene mihu, minda inyeshin. Eja keke nshie mo gobeni bada mishin. Ewo minda ishi. Acho mi ni amate ama Franklin. Mi untwoni ye. Lekma Polyclinic, Meji Laboratory Manager, New York. Call to New Nutumoni if fine. No phone in no champion. My couple of few yode, ni makwe, ni bafi 4 ya Christo me. Agone Esha ini sani, was solid, Edaganu was jeshin, was solid mojenshi. But something happened in a flight, and I have to tell you so that you take it home. As soon as the flight took off, there was turbulence in the air. And at that time, everybody will look up to God. And so they spotted a reverend father in a cassock. And so everybody went to him and was asking him, man of God, do something before we die. Can we go together? Man of God, do something before we die. So everybody was looking up to the man of God in that turbulent moment. But the man of God at that confusing state had forgotten about every prayer that he knew. But he remembered one thing that he used to do every Sunday morning. And so that was what he was able to offer. When he opened his mouth, he said, "Ladies and gentlemen, it's offering time." Ladies and gentlemen, it's offering time this time, please. I'm not coming to take your money. But it is time to offer support towards elimination of malaria. So go home, cover that drain that keeps the stagnant water. Make sure you clear the bushes around. It is offering time. Offer something in support to eliminate malaria. On this note, we will take the closing prayer. And having begun with the Christian prayer, it is only fair that in a country that is very balanced, we take the Muslim prayer. And to say the Muslim prayer for us, please welcome the Imam of the Krowa Municipal, Chief Imam, Imam Alhaji Muhammad Tijani Swala.
Thank you very much. Ni Chair, with your indulgence, please permit me to say the closing prayer. I acknowledge all of you by the power vested in me by the National Chief Imam as the Municipal Chief Imam. I call on the God of Adam, the God of Abraham, Noah, God of Moses and Jesus, God of Muhammad. I invoke his power to pray for the success of this program. I pray for the officials who organize this program. It is a privilege that this program happen in my constituency or perhaps municipality. In that regard, I have to offer a special prayer for this initiative to reach its highest, best peak. In that regard, I pray for the municipality, the assembly, the MCE. I pray for Nietzsche. I pray for the representative of the MP and the candidate of the MPP as well. And I pray for all of you. The best prayer is that which is in your heart. And in that regard, open your heart, tell God whatever you desire, and inshallah, I will invoke Allah to grant it for you. Allahumma salli ala Sayyidina Muhammad al-Fatih ilma ugulik, wal-qatim ilma sabak, nasur al-haq bil-haq wal-hadi ila siratik al-mustaqim, wa ala ali aka qadar wa miqdar al-azim. Allahumma ya sabab man la sabalah, ya sabab kulla ji sabab, ya musabbab al-asbab min ghairi sabab, sabali sabalana nastati ala ut-talaba. صل على محمد وآل محمد أغننا بحلالك عن حرامك وبطاعتك عن معصيتك وبفضلك عن من سواك يا حي يا قيوم يا رب العالمين. I commit this initiative into the hands of the Lord, and I commit all of you into the hands of the Lord until you go back to your various places. May God Almighty Allah grant our wishes and desires. Amen.
Thank you very much, Imam, for that wonderful prayer. Now, these are some few announcements that you have to take note of. We do not want scuffle with our dignitaries. We need to give honor to them. Honor is due. So we will remain seated. Lunch will be served to everybody, but it is already packed. And so we need you to be organized, seated, whilst we give you the lunch pack. If you move out of this auditorium, I cannot guarantee one for you. One plane Nan woba. The one who pay your water. Wabas market you will water and water. Koni lunch na fe and package na fe and wabaja. Koni mo femo. Nini eshe kono. Over ne kote agwe na wanye mbuwe kuwa ha. Le mangame ya baga na fe ni fanjencha asefu wo. Wonto wa sefu mo femo. Ewo mo femo etashi. Koni asefu mo femo. This is how we'll do it. We'll take a photo. We'll have a photo session with the dignitaries. And so quickly, shall we have protocol arrange the chairs so that the dignitaries will take that beautiful, memorable photo. After which we will remain seated. The Akuma Drama Troupe will give us some musical interlude, and then we'll usher out our dignitaries. Now, in the West Wing, we have an exhibition center. Some of you have not seen the malaria parasite before. There are microscopes that we have focused some of the parasites so that you will see how that tiny organism, that tiny species can cause problems to you if you do not do things properly. But if you do not remember anything at all, I am saying that it is offering time. Go and offer support to eliminate malaria in Ghana. Thank you. So, I crave your indulgence, Nana, Professor. Please come over. Let's take that important, memorable photo session with you. Oyineyere, please, you will join us up here. MCE, please join us. All dignitaries and then invited guests, please come up here. These seats are beautifully arranged for you. So let's move the pulpit by the side so that quickly. Yeah, so my dignitaries, the place is set. Honorable Joshua Nee Bote, please do us the honors. Director General Ghana Health Service. All dignitaries, all invited guests, please do us the honors.